Hello, you're welcome to the Fixers Show. Hello, you're welcome to the Fixers Show. Episode of the Fixers Show. I'm so excited about my guest. His name is Arnold Fosah. I haven't seen him in 21 years, so you can see my excitement. And it happens to be in Accra. You know, normally this is not how we do the show, but because this year I decided to do an in-person show. So, Mr. Arnold, you're welcome.
Thank you so much.
Oh, I'm so happy to see you. I'm telling you, you don't know how excited I am to even see Arnold, talk less of talking to him, because when he saw my show, he was like, I'm so excited about what you're doing, because it kind of dovetails into what I do as a person. So I'm so excited. You're welcome to the Fixers Show. But firstly, I didn't introduce you, so I'd like you to introduce yourself, what you do, who you are, to our guest.
Well, first of all, thank you so much for receiving me. My name is Arnold Fosah. I am originally from Cameroon. Right now I'm resident in California in the US, and I work there as a nurse practitioner. I'm a psychiatric nurse practitioner, certified. I've been doing that for about 8 years. And I was very fascinated when she started speaking out about all these really important issues regarding mental health, and I'm so happy I can be a part of it while I'm here.
Yeah. I'm so happy that he too is a part of what we are doing here in Accra. Thank you so much, Arnold. You said you are a
psychiatric nurse.
Psychiatric nurse. That means they deal with mad people. That's what they talk about. They deal with mad people, and I work that too. That's beside the point. So today we're going to be handling a topic called the Narcissistic Personality Disorder. Right. That's what we'll be talking about. And as a practitioner, you said something about the psychiatric nurse and being a disorder. In your own words, what do you think narcissistic personality disorder is?
Right. So in my own words, so I can paraphrase where we get the definition of a narcissistic personality disorder. We use the DSM-5. It's a reference book that we all use in the US. I think it's used in other places, but we use that as a reference for diagnosing different mental health conditions. And we can't talk about narcissistic personality disorder without first understanding what a personality disorder is. So when we talk about personality disorders, we talk about a long-lasting pattern of behavior or a way that the person internalizes their own experience that deviates from what is common in their culture. So we're talking about a way that someone is internally, how they think, how they react to things, how they relate to people. That is just really different from what culturally is normal, so to speak. Personality disorders tend to be fairly stable over the person's life. So it's just like you have a personality. I haven't seen you for 20-some years. I see you, I realize it's you. You know, you have the same personality. And in the same way, people with personality disorders have that prolonged same types of patterns of dysfunction. The problem with personality disorders is that they do cause distress. So you see these people that have personality disorders struggle in different arenas, right? Whether it be relationships, work, marital engagements, those types of things. So going to narcissistic personality disorder, I know this is a little long-winded, but I know there are 3 legs to it, and forgive me if I have to reference it, but I think the first one is grandiosity. So an expanded view of themselves. You have a second one, which is seeking admiration. So they really go at lengths out of their way to seek validation, admiration. They really like that. And then the third thing is a lack of empathy. So they have, well, a limited capacity to appreciate another person's perspective or feelings and respond in time.
Yeah, I know about when you talk about empathy. Empathy just simply means putting yourself in the shoes of another person.
That's right.
That means if somebody lacks empathy,
Right.
so what does that mean? If the person lacks empathy, means he or she doesn't feel the way other people are feeling. Basically, that's it.
Yeah, so it's not really feeling the way other people are feeling. So narcissists experience sadness. They experience the whole range of emotions. It's that when it comes to relationships, at the time when someone is in front of them, or maybe in thought, maybe they're thinking about someone, they have I wouldn't say a lack completely, although sometimes it would be a complete lack, but sometimes they have a limited capacity to, in that moment where they need to engage with that person, understand how they feel. Say someone is in pain and they come and start talking to them. They don't really have the capacity to understand, to put themselves in the place of that person.
Yeah. And there's something you talked about, the fact that they have this high admiration about themselves and all that. I think that one of the things I've seen, probably looking at that, is even when you bring your pain, they tend to downplay your pain to talk about themselves.
Right.
They like to always shift their attention always to themselves. Okay, so what's the origin? What's the root cause? I'm very fascinated. I've been a study, so origin, root cause, as a person in that field, what do you think?
Right. So I'm not a narcissistic personality disorder specialist. But with most mental health disorders, it is a combination of genetics, so what you inherit from your parents, and as well as the environment. With personality disorders, we know that a larger amount of the disorder is attributed to the environment. Okay, so the way you were brought up, certain ways. So oftentimes it's rooted in trauma. It's not oftentimes. We understand that it is rooted in trauma. The nature of the trauma is not always clear, but the idea is there's something that happened within the earlier stage of the child being raised, when they are developing attachments, when they're we call it when the parents is attuned to the child's emotions. Are they being consistent? Because this is how a child learns now how to calm themselves, what we call self-regulate their emotions. So if you have a parent who is inconsistent, absent, or maybe even traumatizing to the child, so maybe puts down the child, and then maybe the parent also responds well to the child when the child does well. Now they're reinforcing different patterns of behavior that come together to make narcissistic personality disorder.
Okay, when you talk about genetics, could you go a little deeper?
Well, we do understand now that, I mean, there are no specific genetic markers that we can identify. But like with many other, again, I say I'm not a specialist, but this is what is generally seen. Parents who are narcissists, or parents who generally have certain mental health disorders, the children are more likely, they have a higher probability of having the same. Now, it doesn't mean that if you come from a home with a narcissist, living with a narcissist, you would become a narcissist. And again, by the way, I want us to just really just preface a lot of this. I wanted to preface this, we've said a lot, but there's a tendency that once we say you're a narcissist, it might seem really judgmental, but I'm really coming at this from a clinical lens, which has no judgment. So I'm looking at it on even playing fields with other personality disorders, other mental health conditions, and things like that. So it's easy for people to perceive that maybe I'm just pointing fingers, they're narcissists, but this is a condition that people struggle with, and people get affected by it.
Right.
So
Yeah, that's true. You're really true. It's really true when you say people get affected by it. And I understand, yes, there is a high probability, definitely, I know, that if you have a parent who has that disorder, it may kind of like unconsciously, it may not even be consciously, flow to the child. And that's one of the things that are very important. Okay, you mentioned a bit about when you were trying to define narcissistic personality disorder, you talked about some of their, you talked about some of their traits. So I want us to look at what are the signs, how can you spot somebody who has a narcissistic personality disorder? Okay, let me break it down this way. We're going to divide it into men, women, and children. Because I don't think that men, women, and children probably, they may be a big, like, something that would, like, say, okay, if you spot this sign, this could be it. But I think there's also something between men, women, and children that there could be a little difference to spot it out.
Right.
So let's start with men. If a man has a narcissistic personality disorder, how would I spot? Or how would the viewers know that this person may be having this disorder?
Okay, that's a good question. So one of the things so with the diagnosis of narcissistic personality disorder, seems like we should have a shorter way of saying that. It usually is diagnosed in early adulthood. Okay, so it's usually not diagnosed for children. There may be signs, but generally, as I understand from the DSM, we don't diagnose it until early adulthood. But my impression of that is that that's when your personality is a lot more stable. You know, when you're going through early age, you know, through your progressive years, you have so many fluctuations in personalities, and you know, it kind of starts stabilizing in early adulthood as you become an adult. So we don't make diagnoses for children. Although you can see elements of narcissism in very little children. But we don't say they're narcissistic. They're narcissistic. We say children are acting their age. A 2-year-old, kind of the world centers around them. So, but trying to answer your other question regarding gender differences, we know 50 to 75, I think. And this is according to a DSM-4 study. That 50 to 75% are men. So a majority of narcissistic personality disorder folks tend to be men. That's one thing. In terms of differences in the whether men or women have different symptoms, there's no differences that I know of, or that I have read about. Maybe some specialists can shed more insight. But there is a criteria. There's a criteria that we use to diagnose, and there's a 9. In fact, I have it here, and I was just going to read it out.
No problem.
It actually makes for good reading. You know, just if I can say it. So there are 9 criteria, and we would diagnose you if we get good history. Again, it's not just, hey, so my doctor said this, you know, and then all of a sudden they conclude. We get a proper history, we see there are these traits, we notice that this is a long history of this trait, and then we can start to diagnose. So 5 of these. So number 1, the person has a grandiose sense of self-importance. So this is, for example, they exaggerate their achievements or their talents. They expect to be recognized as superior without any commensurate achievements. Number 2, the person is preoccupied with fantasies of unlimited success or power or brilliance or beauty or ideal love. Well, in the case of a romantic pursuit, you know, or interest. Number 3, the person believes that he or she is special, and this will show up in how they feel that they're entitled to be treated in a particular way, or they only can relate to people of high status, or they would separate themselves or make snide comments about, maybe they find themselves in the crowd, they'll try to separate themselves out, things like that. And then 4, was that 3 or 4? I think it was 4. So 4, they require excessive admiration. Number 5, going really quickly through these, they have a sense of entitlement, unreasonable expectation of favorable treatment, and automatic compliance. So you will see this between parents and their kids. You'll see this between spouses. Maybe one spouse expects you to just respond to them immediately. They have really just unrealistic expectations. I mean, you can imagine if you gave me a birthday present, I need you to do this big splash. It's got to be a big splash all the time, and if it's not a big splash, there's a problem.
So can I come in 1 minute?
Sure, go ahead.
What you are saying is both ways, that's men and women.
Yes, so there are elements of that, and you know, now it comes down to maybe temperament and how they exhibit these things. And you know, not all diagnoses are equal, right? If you bring 2 people in the room and they say they have depression, it could show up differently. You would still be you'll be able to identify they have depression, but the intensity of it, the range of their behaviors may be different, right? So let's see. Number 6, they are interpersonally exploitative. So they tend to get into relationships to get something out of it. They might do this intentionally or unconsciously, but they always are seeking something for them. So they take advantage of others to achieve their own purpose. 7, lacks empathy. We've gone over this. It's unwillingness they're unwilling, and I could just put in there, they lack the capacity to, in some cases, to recognize or identify with the feelings and needs of others, right? And they're often envious. That's number 8. They're often envious of other people, and they believe that other people are envious of them. And then number 9 is they tend to be arrogant, haughty, so they'll all of a sudden get upset about something, they'll develop an attitude, they seem dramatic, tantrums, things like that. So we look through that, and if there's 5 of that, with a good history, we can establish that.
You're welcome back to the Fixers Show if you are just joining us. This is the Fixers Show, and my name is Deborah Dodoche, aka The Fixer, and I've been talking to my very own friend, Mr. Arnold Fosah, who is in Ghana, Accra, Ghana, presently at the moment, to do a couple of stops for himself, for his career, and I'm so elated to speak to him. We've been talking about we've been talking about the Narcisistic Personality Disorder, and he has really advanced some very, very salient points. And I think if you're just joining us, you're going to just pick up from where we ended. So now I'm going to ask you, if you diagnose a person who has this disorder, what do you do? What are the measures you take? What do you... Okay, after that, after the diagnosis, walk me through what you do after that.
Okay. So typically, people do not come in for narcissistic personality disorder. That's usually not what brings them into the clinic, right? Or for consultation. It's usually a relational issue, or maybe a work issue, but something that has become so dysfunctional that they now need help with. All right? So when we get the diagnosis, what we try to do first of all is we want to adopt the right attitude about what it is we're dealing with, right? We have an attitude of non-judgment about it. We have, for me anyways, and a lot of the folks I work with, we use a trauma-focused approach in dealing with our patients, with the understanding that a lot of the mental health issues that come through our door are rooted in trauma. And so that we exercise a lot of empathy, and we extend empathy towards them in what situation they are in. And then the second thing is we try to create a safe environment, because just a narcissist, a person who struggles with narcissistic personality disorder, they may seem like they have a tough shell, but you know, internally they feel very vulnerable, very insecure, and so you want to extend to them the same degree. Some people have a good insight. They know that, look, my behavior sometimes turns people off, and I don't know why, right? And you do talk therapy to kind of explore what the behaviors are, and just by taking account, you know, start just by them taking account of what it is they're doing, right? Just listening to them. Okay, what did you do at that time? What result did it? What did it result to? Is there any new problem solved? But a lot of it is really really rooted in having a trauma-focused approach. So there are other modalities with that, helping the person to ground themselves in you know, breathing exercises, meditation, exercise, nutrition, right? Yeah. So what we're doing now is that they tend to start self-diagnosing, which is it's good to get informed, but diagnosing is only done by practitioners, people that are trained formally. And why is this important? Because oftentimes the diagnostician knows what the next step is, right? And then the elements of judgment and empathy can be properly appropriated. That's it's a mouthful, but basically the tendency is that when we label someone or even ourselves as having a mental health issue without having a clear path forward, right? We could self-stigmatize or stigmatize other people.
Definitely.
So what we want to do is I would advise anyone who is either in a relationship, working with someone, if they have the information, they can at least band together to support each other, find some support within the community. Or if you need help personally, you can seek help with a therapist, someone who's trained.
I'm in Africa. This one you are talking is America. I'm sure in America you could just walk into a place and go see a shrink or a therapist. But in Africa, it's not. You know, it's people like, how am I going to tell somebody I have a mental issue? You know, the kind of thing. It's not something that is really. That's one of the reasons why we are creating awareness. So that people get to be informed and knowing that, okay, if I have this, I would seek help from the appropriate authority so that I can get better. Because I believe that there are people that want to get better, but they just do not know where to go or how to go about it. Thank you so much, Arnold, for coming.
Thank you, for having me.
Thank you for watching. If you have loved this particular episode, just leave us a comment in the comment section, or you could send me a DM. Or if you want to talk to Arnold, then you can reach out to him so that he's in that field. He can be able to help. Like he said, within his scope, if he can't, he'll refer. So thank you so much, Arnold.
Thank you so much
for coming to the Fixer Show.
And great job with what you're doing.
Thank you very much. I tried. I'm not a therapist. I'm just a fixer. I know you say, this is your name, I don't like it. But thank you so much for watching. This particular month, from now to December, has been dedicated to the issue of abuse. I want to bring knowledge, information about different forms of abuse. I started with domestic abuse, just the physical side of it. We'll go into verbal, we'll go into sexual, we'll go into emotional, we'll go into all that. And I think and I know that by the time we're through with that, somebody will be helped, somebody will be inspired, somebody will be encouraged, and definitely somebody would be transformed. If you're not following us, follow us live on Facebook and on YouTube. Until I come your way next time, it is bye-bye from myself and Arnold.
Thank you very much.
No problem. So bye.
So that's kind of the route we go.
Okay, we go. Okay, so if somebody comes and you discover, because most of the time I think that, because I've dealt with a couple of people having a narcissistic personality disorder, especially when you talked about the issue of grandiosity and always talking about themselves. I think that when